Hello, I'm Dr. Brandt Gibson, and today I want to answer one of the questions that one of my patients asked me is, does changes in altitude, changes in elevation affect peripheral neuropathy? And the answer is really yes and no. Let me explain a little bit. There are studies that show that high altitude sickness, mountain sickness, where they get really, really high altitudes, can cause peripheral neuropathy and can cause poor blood flow and so forth. And because of this, then you know that there's at least a small component of effect of on the nerves of altitude changes. So really what it comes down to is your your home altitude. If your home altitude is at a certain level, then increasing your altitude from that is when it matters. So if you say, okay, I live at sea level and I'm usually at sea level, and most of the time I'm at sea level, and I'm going to go to the mountains. I'm going to go from the coast to the Pacific Ocean to Utah or to Colorado or something like that, and you have a pretty significant increase in altitude. Is this going to affect your nerves? Not directly. There will be no additional nerve damage. There will be no additional changes to the way the nerves are functioning, but you do affect indirectly the nerves through several different things, 3 different areas. Number one, you're going to have a poorer circulation. You're going to have poorer supply of oxygen because the air is thinner in this area. So you're going to actually have to breathe a little bit quicker to get the oxygen in the body. Sometimes as you breathe quicker, you can actually mess up the CO2 oxygen exchange because you start breathing quicker. You're removing carbon dioxide too quickly, and that can actually alkalinize the blood, which can cause some vessel contracture, decrease in the blood flow. You're getting insufficient oxygen saturation of the blood cells in the process of breathing. That's why you end up breathing quicker, just because of the thinner air. So that can be a problem. That can be an effect. But in fairness, most of the time, higher altitudes are not going to make a big enough difference, because you're going to, usually when you're changing altitudes, you're going somewhere, you're changing your activity levels a little bit as well, and that could actually be a positive benefit or a positive effect. So can altitude changes affect your peripheral neuropathy? They can. Typically, it's not a direct one-to-one change where you say, okay, I'm going up in altitude, I'm going up 10 degrees in altitude, I'm going to get 10 degrees worsening of my peripheral neuropathy. That's not the case. You may get some changes. You may get some worsening of neuropathy. A lot of individuals are not going to notice any difference unless you make drastic changes in altitude, significant changes in altitude, then you may notice it. So does altitude changes affect peripheral neuropathy? The short answer is probably not. The longer answer is there's ways that it will influence it and could make symptoms worsen in some situations. In most cases, probably not. Thank you. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 318. Thank you, and have a great rest of your night.